Welcome back. Healthy Living Live. We are coming to you from Norton Brownsboro Hospital. Jackie Hayes is with us, and we're talking about brain disorders today. That's the focus. You can give us a call at 571-5263. Jackie, you had another guest.
We do have another guest. With me now is Dr. Angela Hardwick, and specifically in this segment, we're talking about movement disorders. How would you define movement disorders? And most people think, oh, it's Parkinson's, but there's much more than just Parkinson's.
There really is. You know, movement disorders are a group of neurologic conditions that cause either involuntary movements, abnormal voluntary movements, or slow and reduced movements. And so Parkinson's is probably the most common, most famous one that everyone thinks of, but there's essential tremor, Huntington's, Tourette's, dystonia. These are also in the movement disorders category.
So how do you know the difference?
So it takes a little while to figure it out. Generally, I can figure it out during the first appointment. It has to do with history is the most common, but is the most important, I should say, in terms of how have things been progressing. Additionally, the exam really can help me tease out the differences between the two. And then when we try the treatments, it usually helps me to figure it out if I haven't from history and physical.
Is it important if somebody's been having, or they've noticed a family member with having repetitive motion, is that the time they should seek some help? Because if you don't treat these things, they might be missing a part of their life that they could be enjoying because of these tremors or movements.
Sure. And it's really true if you're having, or family members having repetitive movements, it's really good to at least bring it up to your primary care doctor and make sure they're aware of it. And generally they can kind of help figure out, is it something that we need to address, or is it something that they're actually doing on their own and can be suppressed?
Let's talk about treatment options. For Parkinson's in particular, there is not a cure for Parkinson's, right?
Not at this time.
No treatment.
There's lots of treatment options. We have lots of medications, both oral and patches, injectable medications. If medications aren't completely helpful, we utilize physical therapy, we utilize botulinum toxin injections, and then surgery can even be an option for some patients that don't get full suppression with the other options.
Well, let's talk about that. In fact, I did a story for Norton Healthcare on deep brain stimulation, DBS surgery for Parkinson's patients in particular, and the before and after pictures of this young man, or he was in his 60s, but that's young to me, but he had terrible tremors and couldn't even open his mail. And then after he had the DBS surgery, it was like nothing had ever happened. It's not curing the disease, but it's allowing him to function in a normal life.
That's true. I generally tell patients that DBS is a way of turning the clock back. And so patients may not necessarily be cured, but at least it can take you back to a time when symptoms were milder and when you needed less treatment, less medication, and less therapy needed at that time. And so it's a great tool, and the appropriate patients DBS can be.
Is there a point where Parkinson's has evolved enough or has progressed far enough where surgery is no longer an option?
That can happen. Generally, as it progresses, memory becomes more an issue. Falling, swallowing, and speaking become a significant issue, and these things are contraindicated with surgery.
Do movement disorders increase in the population as people get older? Is that a generality that is true?
They do. The general age group of seeing Parkinson's is about 60, 65 is when the bulk of patients will show up with these symptoms. But as our population has a larger number of patients living longer, we're seeing more Parkinson's disease these days.
I think I read statistics like 1% of those 60 and over might develop Parkinson's, and those people who are 80 and over, it would be more like 4%. So you're right, as people live longer, something's going to pop up.
Yep. Most patients are definitely showing up in that 60 group, but I do every now and then get someone in their 80s that all of a sudden develops Parkinson's symptoms. So your stats are right.
If somebody wanted more information about deep brain stimulation surgery because of Parkinson's or dystonia or some of these other things that are going on, what should they do? Go to a neurologist first?
They should definitely get plugged in with a neurologist to make sure that they're being adequately treated and that their oral and injectable medications are where they should be. And if that's still not helpful, they should be asked to be referred to a center that offers deep brain stimulation, such as our center here at Norton, and they can get plugged in to see if they're an appropriate candidate.
Dr. Hardwick, I just wanted to thank you on behalf of our audience, because a lot of folks are affected with Parkinson's,
right,
and you're really changing people's lives in a positive way. We were able to take a look at some of that video of how this gentleman who, as you said, could not read his mail, and now it's such a drastic difference and improving the quality of his life. So thank you.
Main goal, improving quality of life, because I can't completely treat it, but I can improve quality of life.
All right, Dr. Angela Hardwick, thank you for being with us today. Mike, the patient in that DBS surgery, they do the brain surgery while the patient is awake. So they can tell if they are in the right area or the sweet spot of the brain, they call it, to fix it. And you can see that story at nortonhealthcare.com/Jackie Hayes to find that story on the DBS surgery.